Hi everyone, my name is Grace Ho.
My name is Esha Kalikiri, and today we're going to be discussing revolutionizing lung cancer therapeutics with nanotechnology. I'm Esha Kalikiri, and I'm a rising senior at Cherry Hill High School East in Cherry Hill, New Jersey. I'm passionate about humanitarian causes, including public health and community development. In school, I lead several community service and science-based clubs, and outside of school, I volunteer as a unit ambassador for Cooper University Hospital in Camden, New Jersey, where I care for patients. I also run a 501(c)(3) nonprofit called A Little More Love that supports hospice and palliative care patients who are terminally ill. And in addition to community service, I've worked at several scientific research institutions, including the Low Lab at Drexel University and the Waxman Institute of Microbiology. And my long-term goal is to become a doctor.
My name is Grace Ho, and I'm a rising senior at Stephen F. Austin High School in Sugar Land, Texas. I'm active in school clubs such as being president of Spanish National Honor Society, having been a part of Science Olympiad and Service for Humanities. And outside of school, I'm very involved with my community as I volunteer at my church regularly to help serve those in need, along with volunteering at St. Luke's Hospital in the ICU department, where I assist patients in their respective needs and care, along with partaking in workshops offered by local medical institutions such as Memorial Hermann Hospital and programs such as GHLC in 2023 and 2024. I'm very interested and passionate about cancer and trauma/ER, and I hope to become an oncologist or a trauma/ER doctor.
So, a brief introduction to lung cancer. Lung cancers are cancers that begin in the lungs, and the most common type is non-small cell lung cancer, which is characterized by the formation of cancer cells in the lung tissue specifically. The subtypes of this cancer are typically categorized together because their prognoses or outlooks and their treatment methods are similar. On the other hand, small cell lung cancers are less common but much more aggressive, and they often start in the airways before rapidly metastasizing to the rest of the body. As of 2022, some of the countries with the most deaths from lung cancer were the United States, India, Russia, Brazil, and China, which took the lead with over 700,000 deaths in just 1 year. And so, although lung cancer can present in several different forms, the common denominator is that it is the most commonly diagnosed cancer and the leading cause of cancer death worldwide. In 2022, an estimated 1.8 million lives were due to this type of cancer. And the incidence of lung cancer is only increasing in several regions, including Europe and Asia. Currently, tobacco usage or cigarette smoking is the leading cause of cancer death worldwide. Cancer in non-smokers, interestingly enough, is actually increasing, especially in women, and this is presumably due to secondhand smoke inhalation. Over 50% of women with lung cancers are non-smokers, according to a recent statistic. And for decades, governments have been trying to implement policies against tobacco usage, but unfortunately, tobacco industry interference continues to stand in the way of more exhaustive policymaking, specifically the implementation of bans. So, after acknowledging the issue at hand, it's important to discuss the counteractive measures. So, conventionally, lung cancer treatments have included chemotherapy, radiotherapy, immunotherapy, and sometimes surgical resection. However, with these traditional methods, damage caused to the surrounding healthy lung tissues is significant. Traditional methods pose risks for patients who already have compromised pulmonary systems, especially because these methods alone could lead to a loss of lung functionality altogether. So, unfortunately, after diagnosis, traditional methods alone may not be effective for these reasons. However, when we introduce nanotechnology as a method in conjunction with these traditional methods, the results are drastically different.
So, introduction to nanotechnology. Nanoparticles are small synthetic particles generally derived from polymers, lipids, or metals. Since the size of these nanoparticles are very similar to most biological molecules, they can be safely loaded with therapeutic compounds. They can enter the body cavities and the blood circulation system for lung cancer treatment with minimal invasion and improved bioavailability, which refers to the extent and rate at which a drug can enter systematic circulation and access the site of action. Nanotech usually is not directly utilized as a standalone treatment, but rather it's used in conjunction with conventional drugs and treatments in order to reduce the negative effects and morbidity associated with these methods when they are administered alone. In this presentation, we'll be focusing on how nanotechnology can revolutionize radio and immunotherapy specifically. To begin, radiotherapy uses high-energy radiation to shrink tumors and kill cancer cells by inducing cellular apoptosis. Radiation therapy achieves this by either directly damaging DNA or generating charged particles within the cells that can in turn damage the DNA. Most types of radiation used for cancer treatment are X-rays, gamma rays, and charged particles. Nanotechnology used in conjunction with radiotherapy can facilitate proper photoelectric absorption of radiation, thus increasing the efficacy while reducing the existing radiotherapy dosage and its subsequent toxicity to the surrounding tissue. Now, immunotherapy helps the immune system fight cancer in much the same way it fights off colds and viruses. Immunotherapy drugs prevent the immune system from getting tricked by helping to stimulate a response against cancer cells. Nanotechnologies can act as delivery vehicles for immunotherapeutic drugs. In a typical nanoparticle pathway, a nanoparticle can be loaded with an immunotherapeutic drug, after which it can induce tumor cell death and in turn increase neoantigen release from this tumor. The nanoparticle can also modify the tumor microenvironment in the lungs to improve immune response. To summarize, the future of nanotechnology is promising as it can increase the efficacy of radiotherapy and immunotherapy while also minimizing the adverse health effects and damage to health surrounding tissue. It has the potential to decrease morbidity in patients with lung cancer, and regions currently experiencing challenges with tobacco control and subsequently increasing lung cancer rates may benefit from introducing nanotechnology in conjunction with radiotherapy or immunotherapy as a preferred method treatment, as it can reduce morbidity associated with these methods when administered alone.
As of now, several renowned organizations such as the FDA, the MD Anderson Cancer Center, and Nanotechnology Characterization Laboratory are working to ensure that advancements in nanotechnology are safe and effective in treating lung cancer patients. With new technological advances, groundbreaking research, and upcoming clinical trials, global cancer crises, especially lung cancer, can one day successfully be mitigated. Thank you for listening. And if anyone has any further questions, please feel free to reach out to us at our respective emails. Thank you.